Good morning, everyone. That's what I'm talking about. That's what I'm talking about, energy. I am Talisha Hodge-Thompson, and I'm the Account General Manager and Technical Director for Gainwell Technologies. And today is literally the first all-in-person session that we've had since COVID. And I am super excited about this event today. Yes. And so that we get everybody energized, everybody in the room energized, I'm gonna call some groups and organizations out. I'm gonna say good morning to you, and I want you to give me a good morning back. How about that today? All right, let's start with Gainwell Technologies. Good morning. Yeah. That's right. That's what I'm talking about. Department of Community Health? Yeah. All right. Providers, CMOs, yeah, and all of the vendors. All right, that's okay. They're probably out in the booths. That's okay. Well, thank you for that. I am so glad that everybody is now energized, and we have this big event room where we're gonna have to walk a lot. So I wanna make sure that we are really ready to go. So I'm gonna ask that everybody just stand to your feet for a second. Just stand to your feet. I'm gonna ask a series of questions, okay? If the answer is yes, remain standing. If the answer is no, go ahead and take your seat, and then we'll see who we have left standing at the end, all right? All right, we're ready? Here we go. Are you currently servicing Medicaid members of Georgia today? Have you interacted with Gainwell Technologies employees in the last 30 days? Have you gone into the interchange application, iTrace, or Gamma's web portal in the last 30 days? Were you born in the state of Georgia? All right. Last question. Have you written a healthcare article or written a provider policy within the last 30 days? All right. So we have a few people standing. That is awesome. I'm going to ask that you take the mic and tell us, what did you write? The mic is right there. Right there. Tell us, what did you write? We want to hear about it. All right, so she can't share hers. So is there anybody that can share what they've written that's standing? If not, okay, we're gonna go ahead and give you guys swag remain standing. We're gonna give you some swag for being the last people that have actually written healthcare articles or provided policies in the last 30 days. Thank you. I really appreciate everybody's participation. Oh, that is funny. All right, so now I'd like to take a little time to talk about our provider reps that are here in front of us. Right? For anybody that's been at a Medicaid fair with me before, you've heard me say that they are the bridge between the provider community, Gainwell Technologies, and DCH. Where they're really more than that, right? They are essential connectors to fostering collaboration, trust, integrity, and also making sure that we have a mutual understanding amongst all the groups. We are super happy that they're here and they're with us because they strengthen our partnerships every single day with our provider community and us. I'll stand back a little bit. They also help drive the quality of services that we want to do within the agency. Their role is super critical, and I don't want anybody to forget this, right? They help us meet together as a team and deliver the best possible outcomes. So I want you all to meet this incredible team today, and I'm going to introduce their phenomenal leader, Anita Hester. She's our Claims Operations and Provider Relations Manager, and she's going to introduce her team. Anita?
Good morning, everyone. I don't have a lot of swag like Talisha, but I'm going to try my best. Again, my name is Anita Hester, and I am the Claims and Provider Operations Manager. And we know with all teams, you do have a leader as well. So I first want to introduce our strong leader, and her last name befits her. So our Provider Relations Supervisor, Ms. Sharana Strong. Okay, now we have displayed our Georgia territories. We have territories 1 through 10, that's the North and the South, and then we also have 2 hospital field reps for the North and the South. So first I would start out with Territory 1. For North Georgia, we have Mercedes Liddell. For Territory 2, which is all of Fulton County, Mr. DeAndre Murray. For Territory 3, which is Northeast Georgia, Ms. Carolyn Samuels. For Territory 4, Northwest Georgia, we have Ms. Tiara Johnson. Territory 5, Southeast Metro, which is Ebony Hill. Territory 6, which is Middle Georgia, we have Chantil Bradshaw. Territory 7, which is all of Augusta, Miss Jessica Bowen. Territory 8, which is Southwest Georgia, we have Miss Jill McCrary. And for Territory 9, Southeast Georgia, we have Kendall Telfair. Territory 10, which is all of South Georgia, we have Anitris Johnson. And now we have our 2 hospital field reps. For North, we have Sharita Bentley. And for the South, we have Miss Janie Griffin Weaver. Now we will introduce our in-house. We'll start out with our statewide consultants. We have Ms. Brenda Hewlett and Danny Williams. Next, we have our 2 CBO provider field reps. We have for the South, Darlene Barner. And for the North, we have Auburn Woods Hawkins. Now we will have our in-house reps. And they are assisting all of our field reps. So they are inside doing all of the work. So you may not see them face to face, but they are inside assisting the field reps. First we have Chastity Barrett. Next we have Crystal Gordon. Next is Haley Guyton. Next we have Brandon Stewart, Kaylin White, and Latanya Durden. And you guys stand again for me and face the audience. So this is our face-to-face team that you see when you're asking for a visit. This is the face of Gainwell and Georgia Medicaid. Thank you.
Thank you, Anita. So now that you've met our amazing provider reps team, I want to also tell you that today we have a supporting cast with us today. It is our Operations and Systems Department, and I am truly blessed to have each and one of them here with us today. Everybody that's here, they are working behind the scenes and making sure that the implementations of our policies and procedures are implemented correctly. The reality is that without them, I wouldn't be here. And I want to say thank you, team, for allowing me to be a part of such an amazing team and making sure that we do what we need to do for the Department of Community Health. And just know that you are the heart behind everything that we do. Thank you so much, Gainwell Technologies. Now I'm going to talk about a couple of enhancements that we've done since the last Medicaid fair. One of them is our virtual hold and callback. So now basically if you call into the call center and our hold times are a little bit longer than normal wait times, you have the option of being able to leave your number with what you called in or provide a different number and they will call you back and you can go about your day. So that is a phenomenal feature. We're excited about it and I hope that everybody takes an opportunity to use that if we have longer than normal hold times. Another enhancement that we have is scheduling a consultation appointment. Members can now schedule a consultation appointment with a representative directly through our Georgia Families IVR system. So that's another enhancement that we've done since the last Medicaid fair. Now, of course, I've covered all of the enhancements at this point, and it's super important that we talk about metrics. So I'm going to talk about a few of those metrics because we understand that metrics really tells us the progression that we're making each and every day on the things that we're doing each and every day for the members of Georgia. I'm not going to read all of the metrics. I'm just going to point out a few of them. But the time frame that we're going to cover is April 1st through September 30th of 2024. I will call out provider outreach. We've had over 9,989 provider contacts. Includes emails, phone calls, virtual workshops, and visits. The Provider Contact Center, we've had over 674,000 calls. In the Georgia Families Contact Center, we've had over 114,000 calls. As it relates to provider enrollment processing, we are currently processing applications within 9 days of receipt, and CVO is at 23 days of the 51-day SLA. Resolution and adjustments. We're currently processing adjustment requests received within 10 days of our 30-day SLA. And of course, we've mailed out a number of outgoing letters to equate to about 3.1 million letters. That's a lot. Now, we've talked about metrics, we've introduced you to the team. Now let's talk about what's really, really important. That's teamwork. Teamwork equals success. I truly believe this. Without teamwork, you can't reach the goals that you have. So my motto has always been, for those that know me, teamwork is the key to success. Why? Because it takes the providers. It takes DCH. It takes Gainwell Technologies. It takes the CMOs, as well as the vendors that weren't in the room originally, to make sure that we're driving to where we want to be for the members of Georgia. And the reality is that we all want to make sure that we're providing quality service to each of the members in the state of Georgia. And I appreciate the partnership that we have and the collaboration that we have, because without all of you, we wouldn't be able to achieve the level of success, innovation, and impact what our mission that we're trying to drive for is really reaching toward. It's through our collective efforts that we overcome challenges together and reach new heights in delivering quality services to our great members of Georgia. Now, I'm going to talk about some of the sessions that you guys are going to be racing to in a little bit, just so you know what we're having on the agenda today. Session, of course, the opening session, you're here right now. The 9:55 to 10:55, we'll have the state transition plan and then court care source. 11:05 to 12:05, nursing home and hospice services, and of course, AmeriGroup. We're going to break for lunch, 12:05 to 1:35, and just so everybody knows, the parking, they're going to raise the gates so that you can go out for lunch, and so that way you're not having to pay for parking. So they're going to do that at lunch. They're also going to do that at the end of the day. If you have to leave before the session is over, just buzz in and let them know you're at the Georgia Medicaid Fair, and they will let you out. So we are definitely making sure that we cover your parking today. All right, moving on. 1:45 to 2:45, we're going to have the DCH quality strategy and adult dental, and then at 2:55 to 3:55, current events and eligibility, and then of course Peach State. Now, a few reminders for everybody. Presentations will be uploaded to the GAMIS web portal, which is at mmis.georgia.gov. That's going to be, the presentations will be uploaded tomorrow. We'll have the FAQs uploaded within 2 weeks. But also at that same website, you can see the banner messages that the DCH creates for the providers on a regular basis. Also, if you want to subscribe to the DCH newsletter, you can do that at dch-i at dch.georgia.gov. Now, as I wrap up, I want to acknowledge that we're here today because we all share the same passion. We all share the same passion for the members of the state of Georgia. This isn't a job for us. It's not just a job for us. It's a commitment to improving lives, making a difference, and being the reason our members experience better health and care. And I want to say thank you to each and every one of you for being here today, making this commitment to the great members of Georgia. It's that dedication that makes everything we do here possible. With that, I'm going to say thank you. I hope you enjoy your sessions today. I'm going to turn it over to Mr. Stuart Portman, the Executive Director of Department of Community Health.
Good morning. This is great. The energy in the room, everyone's already excited. Thanks to Talisha and the Gainwell team. This is wonderful. It is great to be with all of you. We have quite a jam-packed day planned. Not only, I will second the general excitement that we are back in person, that we can all interact, that we can have really good presentations and sessions, and then have all the necessary follow-up that we need to do all at the same time. It's something that has been a little novel over the last few years, and we're going to take advantage of today and make the most of it. So I want to really welcome everyone here. I've got a little bit of, a few little icebreakers, get everyone in the mode of participation, which matters today. And then we'll share a little bit about the DCH and Medical Assistance Plans Division approach, strategy, and top priorities at the moment, as well as make sure we wrap up with a few other reminders. So it is always important to note that at the Department of Community Health, our purpose is shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. And when you read that, you obviously have to know the role of the provider is integral, right? That is what we do every day. Within MAP, we also believe very much so that we act as a member-driven payer of high-quality, cost-effective services, utilizing innovation and accountability to promote a culture of excellence. And you all, again, serve a vital role in that. You help us make sure that the members get what they need. You help bring issues to the forefront when we might not see them because you are on the front line. You also ensure that we have high-quality care and that as we all work towards this culture of excellence, it takes everyone. And we need you in order to make sure that everyone's experiencing that same standard. We're going to do a couple poll questions. And for those of you that were participating in the spring Medicaid fair, I was a ripe 7 weeks maybe into the role. And I asked a question, open-ended, about where you could get the best desserts in Georgia. And I will tell you that to this day, I still have people that come up to me to tell me where I can get the best desserts in Georgia across the state. So we're going to go a little less open-ended, and to save everyone a little moment of technology, rather than logging into a website, which worked really well last time, but given everyone is here, we're going to do this with a raise of hands. Okay, a little interactive moment, so everyone's hand should be up at some point with these options. And if not, that's a comment of its own. So we're going to stick to the dessert side first. So we're going cake, pie, cookies, and pastries. By raise of hands, which category is the best? Who feels cake? It's a good showing. It's a good showing. Okay. Pie. Okay. Cookies. Feels a little stronger than cake at the moment. And pastries. Oh, you did not make this easy. I don't know if you have insights here, but there's a pretty close to three-way tie going on. Sorry to the pie crowd, but you all will be able to have a lot of pie. Okay, so good. We got it. We're here. I appreciate that. When we think about the future state of how we engage with the provider community, you have a lot to do in your day-to-day job. But you also have insights that are valuable to how we develop policy in the future. And so I ask a question like this. What would you like to learn more about? What do you think those that you are serving would benefit most from if you had knowledge of. So we're going to do this as a poll. You could be interested in all, but we're going to choose what is the top one. So between dual eligibles, those Medicare, Medicaid beneficiaries, hospital financing, specialty drugs, workforce development efforts, and chronic disease management, those are our options. Who feels dual eligibles is the topic they want to know the most about? There's a strong showing. All right. Hospital financing. Okay. Specialty drugs. Workforce development. And chronic disease management. Okay. Thank you. It's just, while it's not so scientific, it does help us get a sense of what some of the additional types of outreach we could do with the provider community could look like. So I want to start with a few medical assistance plans fast facts. First of all, it's good for you to know just the size of our staff, because you interact with a lot of them. And there is not some secret number that is tucked away within the Sloppy Floyd building. There are 129 of us, and we are working hard to make sure that you get this, you are able to provide the services that are necessary for our members. And we want our members to have as clear of a guideline and as clean of a process to getting the care that they need, and that care is high quality, and that we are measuring it, and that we are improving it constantly. Within MAP, there are 4 units: eligibility enrollment, performance and care management, policy compliance and operations, and service delivery and administration. And you have probably interacted with all of them at some point, especially if you've been working in the state of Georgia for more than a year. Our current enrollment, post-unwinding, post-redeterminations, is roughly 2.25 million enrollees. That is our current number of members. You will hear much more about the redetermination process and unwinding for those that come to the current events and eligibility and enrollment session later this afternoon. Not going to steal Rebecca's thunder. And she will be able to share much more about that process. It has been an immense undertaking. You all know that. It really is a level of review of eligibility that has not happened in decades. It is the large, depending on who you ask, now that it's done, within the world of health policy, there is a debate about whether or not the introduction of the Affordable Care Act or the unwinding post-COVID PHE is the biggest and most significant enrollment and eligibility event in healthcare since, say, the creation of Medicare and Medicaid. They are massive, massive undertakings, and it took a lot of work and all hands on deck approaches. So I just highlight that again because it continues to be a large effort. We are on the other side, but that doesn't mean that we are done, right? There is more work to be done to make sure that we are reviewing all of the applications, that we are getting people enrolled, that we are making sure that when there are issues that arise, we resolve them effectively and quickly. And there's much more we can talk about there. And just as a general sense, when you combine all of the CMO and fee-for-service and additional supplemental payments, and there's a lot of, the budgets are public, you can always see them, but we're talking about roughly $18 billion in total Medicaid spending for the state of Georgia, which, for point of comparison, in case you like that, we are in the top 10 states when it comes to the size of our Medicaid program. So again, thank you for all of your help in the work related to redeterminations. I will also note, in terms of our current initiatives, and I will not go into this now, although the DCH and MAP teams are very aware that there will be much more conversation in this space, we did a recent accounting of current initiatives, policy improvements, things that go beyond day-to-day operations and eligibility and enrollment outreach efforts, including provider outreach efforts. Just new things in Medicaid in Georgia. And there are at least 54, and I can tell you as of yesterday, I'm missing like 10 on this list. We are very, very busy working to improve care here in the state. We do have some areas of focus, though, and those are maternal health, behavioral health, and chronic disease management. They have been priorities. They have been publicly stated priorities in the strategic plans for the Department of Community Health. They were stated very clearly and publicly as the priorities for the procurement efforts that are underway. They will not change as priorities going forward because we have to get to the point where we're seeing improvements in our outcomes. I'm going to go into a little more detail today, though, on maternal health and behavioral health, just to give you a sense of what is being worked on currently. So there are a lot of efforts to improve maternal health outcomes, and I'll show you some data in just a moment. There is regular coordination with the Department of Public Health, right? They maintain a lot of the data review, a lot of the collection to make sure we're looking at outcomes, but we, the CMOs, DCH, and frequently in coordination with Gainwell's provider resources here, are trying to make sure that we are coordinating our efforts as it relates to maternal health care. There is growing investment in perinatal centers across the state. We are working on provider incentives related to OBGYNs. There are new programs and grants that are specific to rural providers, and we are looking to build those out in the years ahead. There's also an increased focus on the mental health of new moms. We know that that plays a large role in whether it is mortality or severe maternal morbidity. There's a lot of work to be done in that space and a lot of standardized work. We know, and this is a sort of a challenge and charge to us all, when someone reaches out proactively to say, I need help, they are getting some world-class care here in Georgia. But as a system, if someone doesn't reach out, are we catching them in our safety net? And the answer is sometimes, and we need to make it always. We're also going to be building on some successful models of care that have been piloted in Georgia in some smaller communities or smaller pilots that we're working to see how we can expand and build up based off of their success. Some are related to cardio OB, and some are more utilizing paraprofessionals in our settings of care. Some specific data. This is pulled from our system, the new system of EASE. If you have not heard of it, there's a lot, the very short version, and I'm not going to pull from our Office of Analytics and Program Improvement. Yes, OP can get, they do a lot of amazing work. And I will just note that there's been a large transition of how we actually utilize data within the Department of Community Health. We have a team that is dedicated to this all the time, trying to look at our data. It can be real time. We can pull a lot more, a lot faster. And just as an example of how well we can utilize it, we wanted to show a few trends. So these are our 4-year trends as it related to mothers with chronic disease or pregnancy-related records generally over the 4-year window. So, excuse me, the 5-year window. So we have just under 300,000 pregnancy records in the last, that are Medicaid members within the last 5 years, up to this point in 2024, I should say, through the end of September. And we also know that the number of mothers who have died within 12 months of delivery is 293. We also know the neonatal death count is 684. Those are very sad, very poignant numbers. And now that we have them, we can see some of the indicators. I'm not going to go into all of this. There are some of you in this room that would love to dive into this in a lot more detail, and we welcome that opportunity. But I wanted to at least present some of these more specific, whether it's chronic disease, related trends, which you can see directionally. Many things are improving, right? Many of these are going the right direction. We are seeing less because our level of engagement has increased. But the actual totals that we are experiencing are still too high. Any maternal death as a result of care is a problem. But we do need to make sure that we are staying vigilant, and that's why we have such a focus on this. We have in years past, and it's not changing until we can continue to see this trajectory go to zero. In the behavioral health space, there is a understanding of the concept of a continuum of care, and it requires diligence at all levels of need. But as we go deeper into what that continuum is, as we discuss more and more about what constitutes outpatient care, what is in-home, What is something that requires some peer supports? What requires sort of an intermediate level of need? How are we taking care of our foster youth? And what is inpatient? What actually falls into those categories? How are we evaluating it? How are we measuring those outcomes on the individuals affected, particularly for youth? And how are we filling in the gaps? So we are working regularly with the Department of Behavioral Health and Developmental Disabilities, and we are working daily here to make sure that we are improving all the levels of care and filling in any gaps that we can identify as it relates to our continuum of care in the behavioral health space. There's a significant focus on mental health parity. There is a mailbox that is active for any parity concerns. There are new models underway. We have both the qualified residential treatment programs and the certified community behavioral health clinics as two that are recently approved and moving forward in terms of from the legislative efforts, and we are working to implement them because they are newer models of care, but that's not all. There are more options for intensive residential care, more intensive in-home care. We have some really therapeutic-focused approaches that are underway and hopefully will be able to be presented soon to those of you that are involved in this space. We also recently had, earlier this year, we're able to move forward with a rate increase for our PRTFs. Our pediatric residential treatment facilities, with the goal of encouraging more placements of those high-risk youth in Georgia so that we aren't seeing so many Georgians going for care outside of the state. So I say a lot of this. I know I'm throwing a lot of information at you before the actual sessions begin, but the point is to say we are active, we are in the weeds, we are ready to engage, and we want your help in doing so. We have a whole bunch of other priorities. A few just to highlight is that we have, as of earlier this month, we have a value-based agreement in our pharmacy program related to sickle cell disease coverage of gene therapy. And that is a very big deal because there are new gene therapies coming to market. The pipeline for sickle cell includes products that I will say is not a manufacturer. A manufacturer can never tell you that it is curative. I will tell you it is very close to that, right? If you take this gene therapy, it is an intensive process, but you will not experience the symptoms of sickle cell again. It is a big deal, but they come with a large price tag, and they don't always work for everyone. And so being able to come to a negotiated agreement of what it means to base the payment on the outcomes, have that as an approved agreement and arrangement, and put that into place for our members that choose to get these treatments and know that we have a way to pay for it that actually puts the focus on value. We are one of like 2 states that has this in the United States of America, and it is a big deal that we now have this infrastructure in place. So. A lot of you also hear a lot about the state-directed payment programs. Just as a note, those total over $2.3 billion in additional dollars that flow towards, and there's a quality component, but they flow towards improving care and making sure that we bring some of our rates to a place that is more sustainable. We have new rural stabilization grants to incentivize GME in rural settings. There is a procurement that is about to kick off in earnest on PACE. And there's a lot more about the PACE program that could be discussed. We talked about it a lot in the spring Medicaid fair, and for the sake of trying to throw some different topics in, we didn't bring it up as a session today, but I can almost guarantee you it'll be a topic in the next spring Medicaid fair because we want participation and we want to bring out a strong network of providers to care for those in the state that can benefit here. There's also, and I will note, this is my favorite of perhaps the nerdiest of the concepts that we can talk about here, but it affects every one of you, and it is just a fantastic change that we are working on in Georgia with an amazing team, is that we are going through a policy manual update and standardization, and we will have completely updated to this year, not just this decade, but this year, policy manuals standardized in the same format, with the same page numbers, with the same fonts, with the same everything that makes it look like they were created at the same time. all 46 or 47 of them will be updated and up to speed, and it's not about comparing ourselves to other states, but I will talk on every stage with other state Medicaid directors and highlight the fact that Georgia will be the only state with completely updated policy manuals, and it's a big deal. And just for the purposes of the focus on transparency, just want to highlight that we have state plan amendment approvals from CMS. There's a large number of them. Just a few of the ones to highlight that have recently been approved include rate increases for all of our waivers, including some new services and comp, rate increases for primary care and OBGYNs, rate increases for PT, OT, and ST, coverage of adult dental, and there's a whole session on that later today, and rate increases for community behavioral health providers. So as you can see, there is a focus on improving access to care with our provider community. Just a couple quick reminders, and then I will wrap it up. First, provider revalidation remains key. There will be plenty of opportunities. You heard it. It came up previously with Talisha. It'll come up again with Rebecca. It is important. Remember to revalidate and to stay current with your enrollment in the state, but also, if you have multiple sites of care, staying current means making sure that it is clear which site of care is the place that you are currently serving patients, so that we know the real number of validated providers in the state. So it is very important. It is essential for our provider networks and guidance of some of our policy development as well. And just as a side note, and a lot of you have done really great work here, please continue to speak to your patients about pathways to coverage. There is a booth here today where you can learn more about pathways, and you can be able to pick up whatever skills you need to share with your patients that might be able to benefit from this program. But it is good to have the resources you need. The CMOs have done an immense amount of work in outreach to make sure that folks know. The state has spent a lot of time trying to travel around to all kinds of settings, whether they're academic, community fairs, just anywhere around the state to talk about pathways. But the number one place where we know where patients will show up is to the providers. So making sure that you have the resources you need, both in your office and in your minds, so that you can actually share necessary information, will help more individuals get enrolled if they are eligible. So just a reminder to continue to engage with all of the outreach that will continue. So thank you all. Looking forward to a great day today, and I'm so glad that we can all be here together in person.
All right. Now that we're all ready and energized, and Stuart has given us a lot of insightful information, I know you guys are excited, right? Excitement? Excited? All right. We are ready. We are getting ready to get started so you guys can go to the sessions. Again, I want to thank each and every one of you for being here today, because without all of us, we couldn't make this possible for our members in the state of Georgia. So thank you. Continue being amazing. And remember what I said, teamwork is the key to success. Thank you and have a great day.